center of the cardiovascular system, which is the heart. The heart is a very important organ. If it stops, we know that we die. Very basic information. So the heart is not alone in the thoracic cavity. Marami siyang katabi ng ibang organs. Definitely, the lungs are very adjacent to it. If you will recall, merong yung left lung, the medial surface has what we call a cardiac notch, where most of the ventricular surface of the heart rests on. Okay, kung mapapansin nyo, uh, yung depiction ng chest organs dito are mostly uh, wrapped by epithelial and connective tissue linings. So, again, recall, no? Sa lungs, we have your pleura. No? So, kita dito sa image. Sa heart, meron ding similar structure. Uh, it's your pericardium. Now, there's actually several layers to it, pero we'll only discuss yung layer na pinakamalapit sa puso. No? So, the serous pericardium, yun yung immediately nakadikit, nakabalot sa puso. And it actually has two more layers pa. So, si serous pericardium, remembering, no, si visceral pleura, serous fluid. So, si serous pericardium, uh, it allows for the creation of a almost frictionless surface where the heart can move around in. At the same time, na-maintain siya dun sa position niya sa chest cavity. Kung wala itong pericardium na ito, and the heart is continuously pumping, no? It's going to flail around the chest, and it's going to hit against the great vessels, your lungs, your diaphragm, causing all sorts of problems. Now, sa serous pericardium, since the heart is always moving, it has to create that frictionless environment, no? Kasi otherwise, if the heart continues to keep moving, yung mga areas where it constantly rubs against, kakapal, magiging matigas, no? And we don't want that. Okay, so there are two layers, your parietal pericardium, which is the layer farthest away from the wall of the heart, and then your visceral pericardium. The visceral pericardium is the one closely adherent to the heart, uh, being that it's also known as the outer layer of the heart, which is the epicardium. So, between the two, there's thin fluid, mostly water ang component, called your serous fluid, na naka-ipon dun sa space between the pericardium layers. No? So, if uh, if you will recall, if you've watched the uh, movie, yung si Doctor Strange, di ba? There was one time that they were having a battle and inside one of the temples, no? And then he got stabbed in the chest by one of yung soldiers ni Caecilius, no? So he had to teleport himself into the hospital and look for his uh, ano ba, paramour ba to? So si Christine, no? Yung ER doctor. So he went in, and then in the most non-sterile of procedures, na wala man lang sabi sa nurses or whatever, they did a procedure called pericardiocentesis. Kasi nung nasaksak si Doctor Strange, syempre may dugo, no? May blood vessels din around the heart, not just the heart itself, no? So some of those vessels probably ruptured, and definitely napunit yung pericardial area nung sinaksak sa kanya. So it caused movement of blood into that space. Yung movement ng blood sa space kasi na yan, it's going to be continuous kasi mabilis ang daloy ng dugo sa area. and it's going to keep expanding, and that space stops the heart from expanding completely during relaxation. So in effect, pangit ang pumping ng dugo ni Doctor Strange. Kaya kailangan nilang higupin yon, no, through that procedure. So, yan ang involvement ng pericardium and one of the dangers kung mapunit si pericardium. No? Okay. Oh, apart from the pericardium, you have several layers to the heart pa. No? So, after the epicardium or the visceral pericardium, yung pinakalabas, immediately, yung middle layer is the thickest and the most, actually, the most important layer of the heart, which is the myocardium, yung muscular component niya. So, yung myocardium is formed by specialized cardiac myocytes, no? Uh, if you will look under the microscope and compare the cardiac myocytes with the average skeletal muscles, they're both striated. So, meaning merong bands, no? Because yun yung connection ng actin and myosin. No? And then, si heart, ang difference is that one nucleus per cell uh, controls yung branch, pati yung branching ng muscle cell na yon. So, medyo mas malawak ang supply ng nucleus na yun. The cardiac myocytes actually form branches, no? Hindi sila yung pa isa-isa ganyan. Kasi yung branches na yun, um, enables faster conduction of electrical signal as opposed to kung isang band lang siya. And then, the distinguishing feature there is a specialized system of cell junctions called the intercalated disc. So, si intercalated disc, siya yung anchor points for the actin-myosin bands, and at the same time, it has what we call gap junctions. So, parang in between cells na magkakatabi, merong butas, no? Kasi it's a portal for communication of intracellular solutes like your sodium, potassium, yung mga electrolytes niya. So, if ever man na-discuss yung concept ng action potential sa inyo sa 102, or if not, yung yung nerve impulse na alam nyo, which is formally known as an action potential, uh, it happens because of a change in the amount of electrolytes. So, yung change ng sodium on one side and the other, and then yung change ng chloride on one side and the other, change ng potassium on one side and the other. So, di ba, meron silang positive charge, may negative charge. So, pag nagbago yun, nagkakaroon ng shifting in electric charges, it causes that action potential. Kaya nandyan yung intercalated disc para mas mapabilis yung spread, yung change ng polarities na yun, para yung movement ng nerve impulse through the whole of the myocardium is faster. Kasi if hindi, masyadong mabagal ang movement ng electrical signal, and it takes uh, less than milliseconds, magiging uncoordinated yung contraction ng muscles. Pag uncoordinated ang contraction ng muscle sa puso, hindi effective yung pump. Baka hindi makapag-eject ng dugo palabas. Okay? And then the last, the inner lining of uh, the the heart wall is your endocardium. So the endocardium, similar siya kay endothelium sa blood vessel in the fact that both are smooth surfaces. Ang dugo kasi, ah, tandaan, hindi lang yan fluid, may mga solid, may mga cellular components. Pagka magaspang ang surface, yung dugo, turbulent ang flow. Pag turbulent ang flow, mabagal, inefficient, pwede mag-form ng pamunguo kasi mabagal ang agos ng dugo. No? Kaya importante yung smooth surface provided by the endocardium. No? Sa endocardium, mas complex siya. Hindi siya single cell layer unlike your small vessels. No? Mas matibay siya. because of connective tissue components, pero ang special about the endocardium is yun ang location ng specialized cells na part of the conducting system of the heart, which we will discuss later. So, dyan actually nangyayari yung initial spread of action potentials coming from your pacemaker down to the rest of the heart para coordinated ang kanyang contraction. Okay? So, easy enough, no? The rest of the anatomical terms, please look them up. Madali lang yan. The heart is a very familiar subject, I'm sure. Okay, so move tayo to the next. Okay, so this one probably a little less familiar. So now let's go inside the heart and look at the chambers as well as the cardiac skeleton. So itong image natin to the left, no, that's a diagram depicting the flow of blood through the chambers of the heart. No? So pag sinabing atrium, no, parang sa mall, meron kang atrium. It's the main chamber that receives all the blood coming into the heart. No? Parang sa mall, dun ang unang puntahan ng most of mga tao. No? And then the blood gets distributed to the rest of the areas after the atrium. Pag sa left atrium, okay, remember ha, anatomical terms. Pag nakakita kayo ng drawing, ang left na nasa drawing is on the right of the drawing kasi it's depicting anatomical position. Meaning, ito yung left. So, pag in-imagine mo tong picture na to on your own body, yun yung left side. So, kailangan sort of mirror image sila. Okay? So, si left atrium receives blood coming from the pulmonary veins. No? So, this is blood coming from the lungs, while the right atrium receives blood coming from the rest of the organs through the vena cavae. Okay? So, si superior and inferior vena cavae. And then, the other two chambers, sa more inferior side are your ventricles. So, si ventricle, sila naman ngayon yung nagpa-pump out the chamber that pumps out blood. So, sa left ventricle, receives blood from the left atrium and then pumps it out through the aorta, and si right ventricle receives blood from the right atrium, pumps it out through the pulmonary artery. Okay? So, papunta sa pulmonary circulation naman. Okay. So, madali. Easy enough, no? Let's go to your cardiac skeleton and the heart valves. Ito, this one you probably haven't encountered yet. Merong skeleton ng puso, pero hindi yan gawa sa buto. Okay? It's just fibrous rings, so fibrous connective tissues. So, medyo makunat lang. That makes sure na yung heart, as a hollow organ, naka-blobo lang siya, hindi siya magko-collapse. At the same time, it serves as anchor points for the bands of muscles. No? Your myocardium are muscles and they require to have anchor points, otherwise useless yung contraction nila. So, ayan, makikita nyo dun sa picture, no? Na nakadikit. Parang yan yung origin and insertion ng cardiac muscles mo. And at the same time, within the rings of fibrous connective tissue, dyan ngayon yung inyong heart valves. So, the valves serve to prevent backflow of blood as it gets pumped from one chamber to the next. So, again, same tissue component as your cardiac skeleton. So, yung valves natin, you have four. Okay? If from left atrium, so left atrium to left ventricle, that will be your mitral valve. So, ito siya. Okay? Mitral valve. And then, from left ventricle, palabas into the aorta is your aortic valve. So, here in this image, no, we're looking we're looking a little at the left surface. So, itong nakaharap sa atin is the left surface. Ito yung likod, ito yung harap. Okay? So, aortic valve going to the aorta. On the opposite, right atrium going into the right ventricle is your tricuspid valve. The tricuspid valve, and then blood pumps out, goes to the through the pulmonary valve to be pumped out of into the pulmonary veins papapunta sa baga. Okay? So, easy enough. Okay? Tandaan that your valves are uh, directing the flow of blood one way. So, pag pumalya sila, yung backflow yung nangyayari. No? So, nagkakaroon ng cardiac disease. Okay. So, yung bawat valve nyo sa yung naka-guard between the atrium and the ventricle. So, that's your tricuspid and mitral valve. Both of them actually are connected into the endocardium of the ventricles themselves by a structure called chordae tendineae. Okay, sulat natin ha. So, chordae, Latin. Chordae tendineae. So, dalawa E. Okay. So, in English, tendon strings. This is what you call the heartstrings. Yung heartstrings na yan, the chordae tendineae, serve to anchor the valves para pagka pa-expand yung puso, bubukas, nako-coordinate niya yung pagbukas ng valves para bumaba na yung dugo sa ventricle. And then when the ventricle pumps, matic, through a property of elasticity, magsha-shut yung valves guarding the atrium so that when the heart pumps out blood, ang direksyon lang ng dugo is through the aortic or pulmonary valve palabas. Okay? Okay. So, after this, we move to the next slide. Okay, so continue tayo. So, we know now the structure, the spaces within the heart as well as yung muscular component niya, which is the pump. Now, let's talk about what controls and coordinates yung function niya na yon to contract and pump out heart. Okay, let's think for a moment yung mali. What if all those muscles, yung cardiac myocytes, contract at the same time lang? Parang sa parang if you're going to do a bicep curl, no? Sabay-sabay lang magko-contract yung biceps brachii, brachioradialis. Ah, paano kung ganun? Aagos ba ang dugo o hindi? Remember, you have four chambers. Two chambers are receiving blood, and then two chambers should be pumping out blood kasi dapat mag one-way flow siya eh. Kung sabay magko-contract yan, pipigain niya lang palabas lahat. So, blood from, kasi may pressure ka on all sides. The ventricles, when they contract, they're going to exert pressure on the AV valves, your mitral and tricuspid valves. At the same time, they're going to exert pressure against the pulmonary and aortic or the semilunar valves. Pero kung mag-exert din ng pressure si atrium, they push down niya din yun. Since medyo mas malaki si ventricle, no, medyo matatalo niya yung atrium. So, ang direksyon ng dugo na mangyayari from the atrium, palabas na ng kung saan siya nanggaling. So, eventually, after just a few seconds, blood's going to stop the flow. Huh? So, yun yung problema. Kaya, meron tayong tinatawag na conducting system so that the contractions between the heart chambers are coordinated na hindi magsasabay, hindi rin sobrang magkalayo from one another. Okay. So, if you will look at the image to the left, nandyan lahat. Actually, this is a good and detailed image of the structures involved in the conducting system of the heart. So, let's talk first about yung pinaka-famous, what is known as the pacemaker of the heart, which is the sinoatrial node. Kaya siya sinabing sinoatrial node kasi it's located in a sinus, the hollow space, within the right atrium. Kaya siya sinoatrial node. Nandito malapit sa baba ng superior vena cava. So again, the sinoatrial node is located on the endocardium. So yung buong conducting system natin, yung mga nodes, the specialized cells that discharge action potentials are located on the endocardial layer of the heart. So, si sinoatrial node, kaya siya tinawag na pacemaker kasi siya yung unang nagpo-produce ng action potentials. It actually produces action potentials without command from other nerves, lalo na sa central nervous system, but it can be influenced. So, the average rate of fire, yung average amount of action potentials discharged by that sinoatrial node is around 70 to 80. So, yung 70 to 80 yun, that's middle. Ang normal heart rate natin, guys, is 60 to 100. Kung hindi sobra o hindi kulang dun sa numbers na yun, that's normal. So, yung 70 to 80 makes it right in the middle so that kahit umbawas ng onte or dagdag na onte, within normal heart rate pa din tayo. So, your sinoatrial node can be influenced. So, if you will recall, yung catecholamines, the norepinephrine and epinephrine, si dopamine din kasama. Hindi lang sila galing sa adrenal glands, they also exist in your central nervous system. So, pagka dumating yung point, naglalakad ka sa kalye, biglang may nagtutok ng kutsilyo sa'yo, no? Fight or flight. Your body interprets its observations in the surroundings, detects danger, and then secretes more norepinephrine and epinephrine plus dopamine. And yung signals na yun, yung mga neurotransmitters na yun, they eventually get to the sinoatrial node and influence it to increase the rate of fire. So, in effect, tataas ang heart rate nyo kaya kumakabog yung dibdib pag takot. Okay, so from the sinoatrial node, it sends out action potentials or nerve impulses into the atrioventricular node. So, from si atrioventricular node, dyan na nagkakaroon ng pagbabago. Apart from that, si sinoatrial node, meron din siyang conducting pathway from the right atrium directly going to the left atrium. Kasi kailangan sabay halos yung atria dahil they have to send blood down. No? So, direct ang contact nito. Whereas, pag papunta na ng ventricle, dadaan mo na kay atrioventricular node. Si AV node, malapit siya dun sa septum ng puso. Pag sinabing septum, is just a dividing structure. So, between, right at the interatrial septum. So, si AV node, nagdi-discharge din siya ng signals on its own. Pero kung may manggaling na senyas from sinoatrial node, then definitely magdi-discharge siya. Now, the rate of fire of the AV node is designed to be slower. Kasi, hindi, di ba kanina we discussed, hindi pwedeng sabay ang pag-contract ng atria sa ventricles. Otherwise, blood will definitely not flow. So, that slower rate of fire from the atrioventricular node creates a delay in the signal pababa sa ventricle so that merong time para yung flow of blood coming from the left atrium, merong time para pumuno muna dun sa ventricle para maximum yung volume na pwedeng ilabas ng puso. Okay? Next. So, after the AV node, it sends its signals down into the interventricular septum by means of the bundle of His. No? Hindi siya bundle of HIS, bundle of His. The bundle of his, ano lang yan, delivery system lang yan. And then, at some point in the middle, it branches into the left bundle branch, going to the left ventricle, branches right, on the right bundle branch to the right ventricle. And then, yung familiar sa inyo siguro to, yung Purkinje fibers, yan ay yung mga dulong nerve endings ng bawat bundle branch para yung signal may distribute throughout the ventricular walls. Okay? Naintindihan ba? So, memory lang siya. Pero, if you will look at videos on how the conduction of electric signals or action potentials facilitate yung coordinated contraction relaxation between the atria and ventricles, mas ma-appreciate niya. Okay. In medicine, we can actually detect this conducting system by means of electrocardiography, yung ECG or EKG, pareho lang yan ha. 12-lead ECG, okay, same. EKG kasi yung German, electrocardiogram. So, it just gives us a visual representation kung tama ba yung flow of action potentials throughout the heart. Kasi nga, pagka merong aberration dito, we will know kung may sakit ba yung tao or at risk ba for developing sakit sa puso. Uh, siguro, naka-encounter na kayo ng mga ina-advertise na mga necklace, no? Tapos merong symbol. Ayun yung ano. Yung ECG ng puso. No? Para you know that I'm alive and I am a living, breathing being. No? Para deep. Okay. Kaya lang, minsan may nagpapatato pa. No? Lalagay ng tato dito sa braso. No? Merong ECG tracing. Tapos, here you come, knowing the correct ECG, tapos makita mo, baka may atrial flutter yung tao, baka mamatay ito. Okay? So, there is a normal ECG, what we call a normal ECG, and there are actually components, pwede mong hima-himayin that signifies what is going on in the heart at this time. So, this is a normal ECG and I don't expect you to master this concept. Pwedeng dumating lang to sa exam na pahapyaw, maybe 1 or 2 questions lang para lang alam kung familiar kayo. Kasi once you get older or if you have to accompany your relatives sa hospital, you're probably going to encounter this. Para lang hindi siya sobrang alien sa inyo. So the ECG tracing, may makikita kayong rises and falls, no? That's the wave of positive and negative electric charge. So, ito si P, yung pataas na una, the P wave, it signifies yung atrial depolarization. Pag sabing, yan pa lang yung signal, electric signal. After mag-run ng electric signal, tsaka magko-contract si atrium. So, at this point, nagko-contract na si atrium. Okay? And then, this is what we call a QRS complex. Yung QRS complex, that's just simply the movement of electric signals down into the bundle branches and then through the Purkinje fibers. Kaya siya medyo ganyan up and down kasi merong sudden change in direction of electric signal. And then after here, itong flat na to, yan yung time na nag-contract na yung ventricles. So, what we're seeing here are the electric signals, yung flat na areas dyan are points where uh, there's actual contraction of the heart chambers. And then the last, yung T. U wave, ito we don't usually see this. Pero yung T, normal yan. No? Parang reset yan. Yung point of reset yan ng electric signals ng puso, ready for the next set of action potentials to fire. No? So, ganyan lang siya. If you want, in your study guide, there's a space, no? Para lang makapag-practice kayo to draw your own ECG, normal ECG tracing. Para yan yung papakita nyo dun sa gagawa ng alahas na or yung tato na, oh, gusto ko ng ganda na to, ganyan dapat ha. Kasi baka sabihin nila, nag-VVTAC ako. Matay na pala ako, biglang may nagsabi sa akin sa trainers. Okay? Sige. Okay. So, we're now down to the last concept in cardiovascular system, which is cardiac physiology. Papaano ba ang pagbomba ng dugo, ng puso, and what are the things in the body, diba? External factors and internal factors that affect how that function is done. So, the most important determinant of how the heart functions, if it's functioning properly or not, is cardiac output. And itong bagay na to, you should never forget kasi you will encounter this definitely when you read further into aerobic training, endurance training, no? Tsaka sa exercise physiology, definitely. No? So your cardiac output is the amount of blood moved by the heart as it beats within a minute. So maraming beats yan. Ha? Hindi lang siya sa isang tibok. Yung isang tibok, the amount of blood that the heart can eject is called your stroke volume. Parang sa cylinders ng engine ng kotse, yung stroke na. And then your heart rate definitely is the amount of beats per minute. So pag minultiply mo yan, you get milliliter per minute, which is your cardiac output. Correction dun sa lecture guide, nakalagay kasi sa stroke volume, ml per minute. Dapat ml per beat, no? Or per cardiac contraction. Okay. So, there are many factors that can affect this cardiac output, yung performance ng puso. But the biggest factor that directly affects it is actually your venous return. You'll see here. No? During rest, ito lang actually yung magde-determine kung ano yung cardiac output mo. Kasi at rest, no, the flow of blood through the veins is relatively slow. So, yung vessels, they're at a normal vasomotor tone. So, yung medyo static yung situation. So, kung ano lang yung bumabalik sa vessels after passing through the organs, yun lang din yung pupunta sa puso, yun lang din ang ibubomba ng puso. Ang cardiac muscle nyo, kahit lumakas sila, kung ang babalik lang is say 500 ml, no? 500 ml lang ang lalabas. They're not going to increase the amount of blood that gets pumped out. To an extent, actually, walang negative pressure ang puso. Unlike your lungs, no? Kasi puso, muscular siya eh. Your lungs are elastic and non-muscular. So, they rely on a negative pressure. Okay? So, yun. At rest. However, this venous return can change, can be improved actually. And this is something that you can advise to your kasama nyo na athletes, to your future clients, or if you become doctors, to your future patients, if you become coaches, to your future athletes. No? So your venous return, eventually the cardiac output, is influenced by several factors. No? One is your thoracic pressure or intrathoracic pressure, yung pressure na nasa loob ng thoracic cavity. Remember yung concept of the negative net pressure within the pleural space that allows for better expansion, yung pag-pull ng hangin na positive to fill the lungs, which is zero, so yung gradient na yun, no? When you take a breath, yung expansion also happens in the thoracic cavity, the chest cage. And lahat ng mga structures sa loob are actually uh, sort of adjacent and attached to one another by connective tissue. No? So, pag gumalaw si chest cavity, yung mga spaces ng connective tissue na yun, mag-expand din yan. At kung ano man yung organ na nasa loob, maaapektuhan nun. So essentially, whenever you take a deep breath, you're generating a larger negative pressure within the chest cavity itself. One of the organs affected are actually your vessels, the great vessels in the heart. Remember, yung heart hindi siya masyadong maapektuhan ng change in pressure kasi nga muscular siya. So yung less muscular na vessel, which is your large veins, the superior and inferior vena cava. If you will note sa anatomy, you look at their location, yung ends kung saan sila nakadugtong sa puso is within the thoracic cavity. And because of that negative pressure na naapektuhan yung veins, your blood in the veins is actually literally pulled up, or if coming from the head, pulled down into the right atrium through the vena cava because of that negative pressure. So, importante, no, yung mga deep breathing exercises, it actually helps improve blood flow when you're at rest. O yan, another explanation for the physiology that occurs in meditation. Okay, so apart from that, syempre, if you're exercising, you're breathing faster, mas madalas yung expansion ng chest cavity, mas malaki. Uh, Cardiac output is affected by increase in venous return in that manner. Also, there's what we call a muscular pump. No? Kasi yung mga veins nyo, since wala sila masyadong muscular component, they rely on the muscles around them, the skeletal muscles, na pag nag-contract and relax, meron ding small negative pressure gradients that facilitate yung movement ng dugo. So, pagka nag-contract, may positive pressure ka against the vein, pushing blood upward. Pero at the same time, yung nasa gitna niya, yung pababa naman, push down din. Pero once mag-relax yun, because of that change from positive pressure to negative pressure, yung naipit pababa dito na dugo will tend to move up. Huwag mag-contract siya ulit, push upward further yun, and then the cycle repeats. So that's what you call your muscular pump. The pump generated by the skeletal muscles against the veins. The next is venous capacitance. No? Pag sinabing venous capacitance, it's the capacity of your veins to hold more blood volume. Remember that they're less muscular, pero they're also made of elastic and reticular connective tissue, meaning they have the capability to expand without bursting. So, mas madaling mag-expand, mas maraming dugo na nasa veins. And then, that increased amount of blood is affected by your muscular and thoracic cavity pumps. So, mas malaki yung venous return, definitely. And then the last, no, is total peripheral venous resistance. Vascular resistance, sorry. So, pag sinabi kasi natin total peripheral vascular resistance, diyan na pumapasok ngayon yung age. As you get older, all of your blood vessels, particularly the arterioles and the venules, mas nagiging makunat sila. They become less elastic. And when your vessels are less elastic, it actually increases the overall pressure uh, against blood flow. So, tumataas yung resistance overall to blood flow. And we all know, by Ohm's law, if you increase resistance, you decrease blood flow. Pag mas mabagal ang daloy ng dugo going down into the arteries, definitely mas mabagal sa capillaries. In the end, definitely mas mabagal lalo ang blood flow into the veins back to the heart. So, kaya yan, one of the problems with aging, kaya nangangayayat si lolo at si lola, lalo na kung walang exercise, no? Dahil bawas na yung muscular pump, yung capacity of the vessels to actually move blood around, nagiging mahina, madaling mapagod, no? Kaya importante for you guys to promote exercise as early. as possible. Pero also to learn how to teach exercise properly and safely, but at the same time effectively to older clients kasi sila yung actually pinaka nangangailangan niya. You prevent early sudden cardiac death. You prevent hypertension from progressing kasi definitely hypertensive na sila. Ah, dahil nga, yun, as old age, no, nagiging less elastic yung vessels. Pero, you can slow down the progression of that, no? And improve their lives and prolong and make the risk of cardiovascular disease less. Okay? Okay, so now, during exercise, dyan papasok yung effects ng central nervous system, particularly the sympathetic nervous system. So you have your catecholamines, epinephrine and norepinephrine, dumadami ang amounts nila in the nerves, signaling muscles, your endocrine glands to increase yung kailangang increase na hormones, blood flow, tsaka gas exchange so that you're able to sustain your body during exercise. No? Eventually, uh, your cardiac muscles, if you exercise, because they're muscles, mas malakas tumibok, di ba? 50 liters per minute. O, saan ka kukuha ng lakas para ipagalaw lahat yung ganong karaming dugo? Eventually, your muscles also adapt, increasing hypertrophy, increases force of contractility. Kasi kailangan eh. And eventually, that actually also increases stroke volume. So, meaning, maliban pa dun sa pagpasok ng dugo, yung sa capability of the heart to stretch to accommodate more blood coming in, dahil may hypertrophy ka na, mas malakas din yung piga niya palabas. So, it also somewhat increases cardiac output. Pero always remember, Venus return and the factors leading to what Venus return will be, sila yung ultimately pinaka-importante nakaka-affect sa cardiac output. Okay? So, I hope this has been enlightening and I hope you learned some things that will uh, be part of how you educate people when it comes to exercise as well. Definitely magagamit ito sa exercise physiology. No? So, please try to understand you very closely yung concepts in cardiovascular system tsaka respiratory system kasi sila yung magiging bread and butter nyo when you become coaches, when you train as professional athletes, mas ma-appreciate nyo yung effects of training. And then definitely endocrine system kasi in terms of fat loss and metabolism, dyan yung makita yung controls. Okay? Thank you guys and see you in the next lecture.